Today we're going to talk about something that I don't give a lot of thought to, and that is medications that should be held before certain procedures. Now, the way this came about is I was scheduled for a PET-CT stress test procedure at my local cardiologist. And the person who was doing the PET scan procedure explained to me that I shouldn't drink caffeine, I shouldn't take my diabetic medication, and so I thought, well, why shouldn't I take my diabetic medication? So, and then that opened up a whole floodgates of what I'm about to tell you. So put this in your pharmacology notes, and today we're going to discuss medications that should be held for procedures. All right, and think about those procedures and what these medications do.
Mountains bow and oceans sing to the creator of everything. Knowledge blooms where faith is sown in his grace. We're never alone. Let us pray on the sky so vast, the wisdom's light to hold us fast. Power comes from the Maker's hand, guiding hearts across this land.
Hello and welcome to this channel. For those of you who are new to this channel, I'm your host and tutor, Annalise Garrison, and today we're going to talk about medications that should be held for different kinds of procedures. So before we get started with today's presentation, anybody that knows me knows that I like to use the 6 steps of the clinical judgment measurement model. So I always want you to recognize cues, I always want you to analyze cues, and what else do? I always say know the top 3 of blank, right? So know, for example, in this presentation, we're going to know the top 3 medications in each category, like the top 3 blood thinners, the top 3 diabetic medications, the top 3 weight loss meds. So let's get started. So the first medication we are going to discuss is blood thinners. Now, why should we hold blood thinners when we do certain medical procedures? To minimize the risk of excessive bleeding during, before, and after procedures. Now, critically think, what kind of procedures run the risk of bleeding? Think about that. Surgeries, biopsies, injections, like any kind of injections into the spinal cord for whatever the reason, injections into the knee for whatever the reason, right? So, and then what else? What other procedure should we hold blood thinners for? Dental procedures, right? So think about that. Hold the blood thinners when we have surgery, biopsies, injections, and dental procedures, because by holding them, it will minimize the risk of excessive bleeding. Now, what are the top 3 most common prescribed blood thinners? It's on the screen there: warfarin or Coumadin, Eliquis, and rivaroxaban. Now, aspirin is a blood thinner, but people can buy that over the counter, right? So that's interesting. Please make a note of it. NSAIDs are recommended that you stop like a week before a surgical procedure, or if a person was to have any type of endoscopic procedures. Go ahead and write this down. Surgery, endoscopic procedures, biopsies, Any type of nerve block procedure, you need to hold the NSAID for that. Any type of lumbar punctures, spinal taps, you should hold NSAIDs for that. Why? Because NSAIDs increase the risk of bleeding. Now, I did not write the NSAIDs like Aleve or ibuprofen. I'm not writing over-the-counter NSAIDs for the, like I said, you want to know the most common prescribed NSAIDs, because if things are seen over, if things can be gotten over the counter, you'll know that. Like, doctors are shying away from prescribing ibuprofen. But like, you can get Aleve over the counter. What's the working ingredient in Aleve? Naproxen sodium is the working ingredient in Aleve. So the top 3 prescribed NSAIDs that you should know for the NCLEX: Celebrex, Voltaren, and Mobic. Now, diabetic medications are interesting. For example, insulin needs to be held when you get a PET scan because it will interfere with the radioactive tracer in the PET scan, right? Metformin should be held when you are taking any surgery that involves if the kidney function is impaired. So, and the reason for this is diabetic medications affect blood sugar levels, which need to be carefully monitored during procedures. People often take herbal supplements and vitamins. So anytime there is a surgical procedure, it's okay to go ahead and tell the client to hold any herbal supplements and vitamins, because herbs and vitamins are not regulated by the FDA, right? And some of these herbal supplements and vitamins can have interactions with the anesthesia and cause adverse reactions. Some of the vitamins, like vitamin E, for example, is an anti-clotting, can have an anti-clotting effect. So that would increase the risk of bleeding when they have surgery, for example. Some supplements have cardiovascular effects and can affect blood pressure. So we know this. Some of the herbal supplements like garlic, ginkgo biloba, St. John worts, these are, St. John worts help with depression. So anytime you are going to decrease the CNS, like as with the anesthesia, you don't want the herbal supplement to be decreasing their CNS as well. I mentioned about vitamin E and vitamin C may reduce the effectiveness of anesthesia. So it's just better to assess whether they're on herbs or any vitamins, and it's just better to say, hey, please stop your herbal supplements and your vitamins, and this is the reason why. Antidepressants are interesting. Again, you do not want to depress your central nervous system while getting anesthesia. So the doctor will say, or you should assess whether the client is taking an MAOI. If they are, you want to tell them to stop it because it will interfere negatively with the anesthesia. Also, if anyone is taking tricyclic antidepressants, like that transacypromide, all right, that's on your screen, the 3 most common MAOIs, right? Phenazine, transacypromide, and isocarbazide. you want to explain to the client that, hey, we need to be careful with these antidepressants, because another thing too is they may interfere with the PCA pump, with the pain control after the surgery. So there's actually two reasons you don't want the client taking MAOIs, because it interferes with the anesthesia and it may interfere with the pain control used after the procedure is finished. Blood pressure medications, okay? Blood pressure medications can cause a dangerous drop in blood pressure when combined with anesthesia, especially the ARBs, right? Like losartan, valsartan, and irbesartan. Okay, you've got to be careful with the ARBs and the ACE inhibitors. These categories of medications are also used to treat heart failure and kidney disease too. Now remember what I said, we hold the metformin when the kidneys are involved. So again, ascertain what blood pressure meds they're taking. And if they're taking angiotensin receptor blockers or if they're taking ACE inhibitors, you definitely want to hold them more so than the other blood pressure meds, because they'll cause a dangerous drop in anesthesia, especially if they have heart failure or kidney failure. Weight loss medication should be held, because these types of medications interfere with stomach emptying, especially the GLP-1 agonists like semaglutide and others like Zepbound and Ozempic. These medications affect stomach emptying because they slow down digestion, okay? And that is a fear that would interfere with anesthesia and surgery as a whole. So, in summary, you want to think about the action of the medication and the reason for the procedure. All right, you're the one that's going to be taking your NCLEX. You're the one that's going to be taking your HESI. You're the one that's going to be taking your ATI. I can't do it for you. So just remember, think about the action of the medication and the reason for the procedure. Remember that blood thinners you want to hold for major surgeries, right? Or even minor surgeries like biopsies. You want to hold blood thinners for dental procedures, and don't forget to hold them for spinal taps and epidurals. When it comes to NSAIDs, they're for inflammation, but they carry a bleeding risk, right? So when you think about NSAIDs, you want to hold for surgeries, both major and minor. There was a question on the NCLEX, or I believe it was somebody's ATI or HESI. I'm not sure, but we came across this question that we should have held NSAIDs for coronary artery bypass grafts or CABG. Remember that, guys, okay? And then you want to hold NSAIDs for any procedure with a high risk for bleeding. Procedures where blood clotting is crucial, since NSAIDs reduce the ability for the blood to clot. And don't forget to tell your patient that if they're taking NSAIDs, they may have bruising may have bruising more easily, not just to cuts, but to also their procedure. And cuts could also take a little longer to heal. All right, so remember to tell your client these things, guys. Very important. When it comes to diabetic medication, check with the doctor. It's more important to hold the insulin, because that's an injectable, than it is the metformin. But when it comes to diabetic medications, we should hold the meds to minimize the risk of not only hypoglycemia, which is more of an issue with the injectables, but lactic acidosis. Also, if the person has any kidney issues or any blood disorder issues, hold the diabetic medications. Again, think about the action of the med and the reason for the procedure. Now, to summarize your herbal supplements, just remember that just hold all your herbal supplements and vitamins, since they're not FDA approved. Well, as far as the vitamins go, remember that vitamin C can interfere with the effectiveness of the anesthesia, and be careful with vitamin K because it interferes with blood clotting. And also remember your herbs like ginkgo biloba, St. John worts, all those are psych vitamins, right? So anything that interferes with psych effects or CNS effects should be held. So, and the same thing goes with antidepressants. CNS depressants should be held. Just remember, what is the procedure for? So, in closing, don't forget that blood pressure meds need to be held because they will cause a dangerous drop in blood pressure. Not just any blood pressure meds. Go back and review the slide that I gave you. Remember, especially the ones that are being given also for kidney failure or heart failure, along with the blood pressure, right? And then also the weight loss medication should be held because of gastric dumping and slow digestion. Weight loss medication slows digestion. So there you have it, ladies and gentlemen. There was a few questions on your exams about this, but because of my life experience and probably yours and everybody else's, we just never give it any thought as to why we should hold certain medications when we have certain procedures. So good luck on your exam. God bless you. And don't hesitate to call me today if you need help with your tutoring of any exam, of any written paper, anything you need help with. Call me. God bless you, and I'll see you in the next video.
Let us pray on the sky so vast, for wisdom's light to hold us fast. Power comes from the Maker's hand, guiding hearts across this land.